huge shade of shock with the way things are going. Perhaps Mumbai is in better shape, but when we see the rest of the country, and we haven't even seen uh, perhaps the real numbers in states like West Bengal, Tamil Nadu, etc., where the election results are going to be announced tomorrow. So, a quick word from you as to how do you assess the situation? You've seen it from last year to this year. How would you assess the situation, and and what is your view of the status in Mumbai, where a large number of our readers and viewers are here today?
So, Pradyuman, it's if you have to compare it to last year, I think we are getting definitely more sicker patients in the hospital, or basically the beds are being occupied by much more sick patients in ICU beds and on the wards. Last year, we got a lot of patients who just wanted to quarantine, quite a few, and who would rather not quarantine in a center, but in a hospital setting. And this sort of increased the bed occupancy. And I would say 50% of that was probably not even required. Even the conditions to hospitalize were things like comorbidities. We've got a little more wiser on COVID this year. And so we know that just because a patient has a comorbidity does not mean he needs to come into the hospital. And so this year we have patients who need a little oxygen, and those, of course, who have multiple comorbidities, and those who are very sick needing ICU care. The clear difference between the surge last year that I saw and this year is that the contagiousness of the virus, and as they call it, this new strain B117, is probably so high that there is it's like a whole family and the whole household is infected, and I think that's what is in stark contrast to last year, where we saw that one person quarantining well at home could probably avoid infection to a significant number of family members. This year, we are not seeing that. And the other thing we are seeing this year is that when the patient, we have been managing, though I must say it's not ideal, a lot of patients on low flow oxygen and even steroids on occasion, I must emphasize this, at home. So that's not something I would have liked to do last year, giving steroids to a patient at home, or for that matter, giving oxygen to a patient at home, because we know that low flow oxygen can be delivered at home, but low flow can easily go to high flow, and that's not easy to manage at home at all. So these differences are very clear to me. I mean, there is a small proportion of patients on low flow oxygen holding out at home and getting better, and on steroids. And the other thing is, of course, the calls, the SMSs, the anxiety has reduced from having COVID, just having COVID, which was last year, to having COVID with persistent fever, which is, again, something that I wouldn't encourage people to get anxious about. But COVID with drop in oxygen. So those have been the SMSs. Should we get hospitalized? The questions that have been coming in on whether, online consults, and there's only that much anyone can manage.